Good morning, everyone, and welcome to the second Early Childhood Grand Round Seminar. I'm Dr. Morgan Crossman, and I have the honor of serving as the Executive Director for Building Bright Futures, which is Vermont's Early Childhood State Advisory Council and Vermont's Early Childhood Data and Policy Center. I'm joined today by our Research and Data Director, Dora Levinson, who's going to be supporting today's tech side and today's session. We are really excited to have some esteemed experts to present on the state of preschool and really situating Vermont in the national context. And, this session is so important in this moment because of the renewed focus on universal pre-kindergarten education on behalf of the legislature, our state agencies, community partners, and families. So this early childhood grand round seminar is really going to set the stage for how we think about evidence and data to inform decision-making alongside the work of the Pre-Kindergarten Education Implementation Committee's work. Before I introduce our panelists today, I want to give you a brief outline of today's seminar and some logistics, and then I'll also provide a little bit of background on Building Bright Futures. So for today's seminar, the first 45 to 50 minutes will be a presentation by our experts, and the last section will be a live Q&A discussion with participants. And we've also passed along all of the questions that were sent to us in advance to our panel. And as you're listening to our speakers today, I'd invite you to pose additional questions in the chat as you're hearing them present. We may not get to all of the questions today, and we will absolutely capture those and pass them along to our speakers for some follow-up. In terms of some of the logistics, we want to ask that everyone please turn off your cameras for the first part of the presentation and make sure that you're on mute as we start the session. And as we move into discussion, we'll invite you to turn your cameras back on. As you are entering the room today, I'd like you to introduce yourself in the chat. So if you can give us your name, your role, organization, whether you're a parent of a child under the age of 8 and where you live, whether you're in the state or across the country. And one of the exciting things about today's seminar is that we are able to offer continuing education credits for those of you who are attending live. So you can email data@buildingbrightfutures.org to receive those credits. We're really excited to be able to offer that for today's session. And if you have already included your BFIS number in your registration, you can consider this handled. Lastly, today's session is being recorded and will be shared with partners who couldn't be with us today. And a brief apology and recognition that many of our direct service providers and those who are working with our kids aren't able to be here because you are actively working with kids and families. So we will record and make sure that we're able to get this information to you, and we will do our best as we think about the scheduling of future events to be cognizant of those pieces. All right, so to kick off today's session, here's a brief overview of Building Bright Futures' role in the early childhood system. BBF is Vermont's early childhood public-private partnership, charged under state and federal statute as Vermont's Early Childhood State Advisory Council, which is really that primary mechanism used to advise the governor, the legislature, and our federal delegation on the well-being of children and families. Our mission is to improve the well-being of each and every child and family in Vermont by using evidence to inform policy and bringing voices together to discuss critical challenges and problem solve. As we think about our primary roles and responsibilities for the system, it's around holding the vision and strategic plan for the state of Vermont, monitoring progress within the system, centralizing and elevating family and community voice alongside data, and making it publicly available to inform decision-making. And then lastly, actually advising our governor, the legislature, and the federal delegation on the needs, the challenges, and the opportunities for kids and families prenatal to age 8. A critical piece of our advisement is the Vermont Early Childhood Data and Policy Center, which serves as a nonpartisan independent source of data, research, publications, and really important information for our policymakers, our partners across the state on the issues and challenges and priorities for children and families. And that center is one mechanism by which we are centralizing really complex data on behalf of the system and making it publicly available. So if you have not yet checked out the new early childhood data portal, please head over after today's session to vermontkidsdata.org. Today's early childhood grand rounds is another mechanism that we use at Building Bright Futures to elevate and disseminate high quality data or data related topics that are impacting Vermont's early childhood sector, or the data challenges that are facing our state and how we bring in national best practice and expertise. The broad work of that center is focusing on monitoring, on transparency, accountability, data-driven decision-making, and continuous quality improvement for the early childhood system. So I'm really excited to be here this morning to moderate this incredible seminar on the state of preschool to help support our knowledge base as a state and as a part of our monitoring portfolio. So now I am very honored to introduce our esteemed panel of experts from the National Institute for Research, the National Institute for Early Education Research, otherwise known as NEAR. So today you'll hear from Dr. Steve Barnett, who's the Senior Co-Director and Founder, Dr. Gigi Weisenfeld, Associate Director of Technical Assistance, and Dr. Lori Connors-Tadros, who is our Senior Research Fellow. We do have more information about our panelists, so Dora just provided the link in the chat for those of you who are interested. I'd love to hand it over to the three of you, and we're really happy to have you this morning. Thank you.
Thanks so much for having us. I'm Gigi, and I'm going to kick us off with our slide presentation, and I will do that right now. Okay, perfect. And thanks so much for having us here today. We have lots of slides, but we will go through them rather quickly so we can get to all of your questions. But today we are going to talk about Vermont's pre-K program, where it leads the nation, and there are many areas, but also there's some areas to consider for the future, and we're going to talk about some of those today. We also want to talk about some strategies or places to build the system in Vermont for capacity, for quality improvement. Also, and I know there are a lot of questions about sustainable funding. Luckily, if you don't know this, but Steve's an economist in his background, so he will definitely be able to help answer and hopefully address all of those many questions. And finally, we'll talk about effective state level coordination and oversight. And I'm going to start by talking about our State of Preschool yearbook. And right now, there are many states that are moving towards universal pre-K, but the ones that are leading the way are, of course, Vermont, which is super exciting. And we're happy that it's such a priority for the state. But there are a number of states that are way behind. So this is one area where we really like to highlight and talk about Vermont's progress. Another area that we look at I realized that one of the slides I thought we were going to be talking about is not here, but our State of Preschool yearbook. So since 2002, NEAR has been collecting information about states' pre-K programs. At that time, there were only 38 states with pre-K. Now in 2023, there are 45. The number of children enrolled has increased, looks like dramatically in terms of the number, but when you look at the percentage of children, about 7% of 3-year-olds and 35% of 4-year-olds. Spending's increased, which sounds like wonderful, except when you look at that per child spending, it really hasn't gone up to the amount that you would think based on the number of children, as well as the number of school day programs. So 22 programs offer school day programs, meaning 6 hours a day. And I know there were some questions about Vermont's 10-hour-a-day program. 10 hours a week program, and what that looks like compared to nationally. More states are moving to school day programs for a number of reasons, not because it's cheaper, but because it actually provides better education for children. It provides more access for families, and something definitely we recommend for Vermont to consider as they're moving to thinking about ways to improve their pre-K program. One of the things we look at NEAR are 10 policy benchmarks. They're research-based, and they're what we consider the minimum of what a state should be doing to meet quality. 5 states met all 10 benchmarks for the 2022-2023 school year. Sorry. But let's think about Vermont for a second and Act 166. So again, this is the 2022-2023 school year. Only a few of states that begin with the 3-year-olds, but DC and Vermont serve the most children starting at age 3. Another thing we like to highlight in Vermont, research has shown 2 years of pre-K is important and is more is more beneficial for children in terms of being able to get all of those benefits that we know high quality pre-K can offer. There's no income requirement for students in Vermont, which is great because it means it really is a universal program. As I just mentioned, the 10 hours per week in academic year is not enough. There really should be, it should be an expanded program to being a school year, school day program. It does operate in a mixed delivery setting, meaning that public school classrooms, private preschools, family childcare homes, there are a variety of settings that children could attend Act 166 pre-K. That's another thing we like to highlight about Vermont. This means that as often as states start to expand to more universal pre-K, it can be challenging if there are not enough seats, there's not enough spaces for classrooms, but having a mixed delivery setting allows that to happen. We know in Vermont, there are a number of rural settings also, so having those other options are important for families. Vermont does meet 7 out of 10 of the near quality benchmarks. Again, these are minimum benchmarks. Class size is limited to 20 children. Screening or referral for children is and referral if needed for pre-K students. The pre-K programs are required to participate in systems of quality improvement, such as their QRS system. Teachers are required to have special training. However, they're not required to have a BA degree. Only a high school diploma is required for assistant teachers, and coaching is only required for some teachers. And those last 3 in red are the benchmarks that we think are important for Vermont to consider as they're looking at changing or expanding the pre-K program. I know there was a question about minimum class size, and that is not something that we typically collect that information. But I don't know, Steve, if you wanted to address a little bit about minimum class size now, or we can move on.
I'll just say quickly, Gigi, it's not an issue in most states because most states pay on a per child basis. And at some point, the class sizes are just not financially sustainable for a private provider or a school district. And so they find ways to have larger classes or to, so for example, mixed age grouping is common in smaller contexts. And also, this is one of the reasons sometimes places use family child care, which reduces the overhead and infrastructure costs for small settings.
Thank you. And I'm going to leave this. I think, Steve, is this your point to start talking? Or
yeah. Thanks, Gigi.
Sure.
We're happy to be here, and we just wanted to, in addition to setting the frame on what's the policy context, how does Vermont compare to the rest of the country? We wanted to set off at the beginning something about what do we know that leads to large persistent benefits for kids from early childhood programs, because that's the goal. And also because it's increasingly apparent that many of our public programs do not produce large persistent benefits at scale. So what do we do about that? How do we maximize our chances that our programs are actually doing what they're supposed to do? And the first is to design our public programs to be as close as possible to the models that research has demonstrated are effective, and not to just engage in wishful thinking about, well, we don't have to have those kinds of teachers, we don't have to have small classes, etc. The evidence is pretty strong that we do, right? There are not a lot of things that are sufficient to produce the outcomes that we want, but there are clearly things that are necessary. And so looking at the models that we know have produced results, whether those are small scale, like the Perry Preschool or Abecedarian programs, or whether they're large scale like New Jersey's state-funded preschool program. The second is to have a continuous improvement system that supports improving effectiveness at every level, from the child, teacher, classroom, to program, all the way up to the full state. Because research isn't going to give you all the answers, and the answers may change over time. That's the nature of education and child development. The context for children's development is constantly changing. We live in a digital world that's would have been difficult to imagine 30 years ago. And so building a system with not just a quality rating system, but a continuous improvement system that actually generates data over time, that enables you to figure. The analogy I use, it's like a GPS, right? It starts with you setting out, where is it that you want to go? And then the data tell you where you are now relative to where you want to go. And it gives you step-by-step directions. This is why coaching is so important, by the way. That's the step-by-step directions at the teacher level for how to get to where you want to go from where you are. And if you don't have that, it's, you know, the chances are you're not going to produce the results that you want. It's also, you know, having said that, what do we mean about where do we want to go? Well, we need to focus on the goals for children's development and well-being, especially the unconstrained knowledge and skills, right? What do we mean by unconstrained? We mean things like language, social and emotional development, mathematics very broadly. These are deep pools of knowledge and skills that you develop over a lifetime. It's not like learning 26 letters. It's not that hard, right? And you're done, right? That's not, you know, so thinking about what is it that you want to focus on in building for the future, it's these deep pools. And then the experiences that will produce those. So I already mentioned language and math, self-regulation, character, developing relationships, also mental and physical health and development. So there are key elements of rigorous policies that are the foundation for making those things possible. One of these is strong teachers. So you have to have, we believe, preparation and compensation comparable to those of teachers in the primary grades. That means a bachelor's degree in specialized preparation in early childhood education. Now, if you're building a system, you can't just say, well, we won't, you know, you can't wave a magic wand and make strong teachers suddenly appear, right? So systems that have been successful with this start with the teachers that you have and develop pathways for them and supports for them to move to get the higher education they need, whether it's for the 4-year degree or the specialized training or both, and sets a timeline for that. New Jersey was under a court order, for example, to when we began our program, that every teacher had to have a 4-year degree and early childhood certification. We didn't have an early childhood certification for them to have when the court mandated that we do that. So we created one, and we created pathways for teachers to do that. And within 5 years, we'd largely accomplished that goal. And it transformed not only the classrooms and their quality, moving an entire system from poor to mediocre to good to excellent, but it transformed the lives of the teachers in those classrooms, who were now fully qualified professionals who identified as public educators with decent pay and benefits, and it's It is transformative for both the children and the families served and for the teachers who serve them. You need, and someone asked, what's the financial support? Well, you know, if there's a silver lining in how poorly we pay early childhood staff, including preschool teachers, it's that the vast majority of them qualify for federal aid for higher education. So, you know, to prepare the teachers for 50,000 kids in the state of New Jersey required a revolving loan fund of only about $1 million. All right, so the most of the costs can be borne by existing financing mechanisms for higher education, because teachers are going to qualify for financial aid. The state share of that was quite modest, actually. Now, of course, that's just initial preparation. It's just like child development, we need to continuously invest in the professional development of teachers. So you need supportive, knowledgeable, site-level instructional leaders, right, who provide coaching, who organize professional learning communities, who assist teachers in using data that are generated by your continuous improvement system. You don't just leave teachers to do that on their own. You need an adequate dosage. Gigi already mentioned this. So, you know, we know as a general principle, one-to-one tutoring is the most powerful tool we have in education. Well, in an early childhood context, that really means individualized learning for every child. Teachers are not teaching a class. They're teaching each child. They're figuring out what each child needs to take the next step in their development in each domain. You have to have small classes to enable teachers to devote sufficient time to planning and developing the experiences intentionally that each child needs. You also need time during a school day to make that happen, a full school day of 6 hours. And you know, you understand that that's the 6 hours contact time for the child. That is not the full day for any teacher in a preschool program. Is spending a lot of time figuring out, okay, what is it I need to do for Samantha tomorrow and over the next week and the rest of the year. And 2 years starting at 3. In our long-term study of impacts all the way through high school in New Jersey clearly demonstrates that our results are more robust. That is, we're much more likely to have a substantive effect. And the effects are about twice as large with 2 years beginning at 3 rather than starting at 4. The every year matters, right? So I see that there was a question about what do we mean by small class size? Well, the most effective programs had class sizes of 12 or 13. And no one does that at scale. The closest example we have to that at a large-scale public program is New Jersey at 15. Colorado, before its most recent program revisions, was at 16. Certainly no more than 20. And this is going to vary depending on, if you think about it, all of the services that, you know, all of the things that we think of as add-ons, the work with parents, the children with special needs, children who are dual language learners. If instead of thinking about adding on layers and layers of additional services to meet the needs of children and families, if we move those all to the teacher, you can support smaller class sizes with that can be financially feasible in a way that's not possible if the teacher's responsibilities are limited to general instruction in the classroom, and you take all those other responsibilities and give them to other people that you're paying, right? So in the United States, in K-12, for example, we have one teacher for every 13 kids. We do not have class sizes of 13. We've chosen to allocate our resources, including our teachers, in ways that do not allow us to keep our class sizes as small as we could if we think about how to do this. So class size of 15 is I think not out of financial reach for a program. That's certainly what I'd recommend. But there are research isn't going to provide a very precise answer to, is 15 better than 16? Well, or 17 or even 18. There's no way to answer that. The closest thing we have is a study of kindergarten children in Tennessee, where class sizes of 15 were clearly more effective than class sizes of 18 to 20. And the estimation by economists at MIT of what's the payoff to that were that the additional costs of reducing that class size were considerably smaller than the lifetime benefits from the smaller class size. Then we do need to provide other supports for teachers. I mentioned already dual language learners. Everybody who's in a classroom understands we have a lot of mental health concerns for young children these days. I don't know that we understand exactly why, but coming out of the post-pandemic post 2020, there are more mental health concerns for young children. And then, there are many children with other special needs. Teachers need support, right? If I don't, as a teacher, I'm having difficulty, then there needs to be a team of folks who can come into my classroom, whether I'm in a private provider, public school, it doesn't matter. There needs to be a team of specialists who can help me figure out what is it I need to do to adequately meet the needs of every child in my classroom. There was a question about, so what, how did you measure these benefits from smaller classes? These are things like children progressing at grade level and not repeating grades, reduced need for special education. But the really big one was that children in the small classes were more likely to graduate, go on to post-secondary education, and make more money for the rest of their lives. That's a pretty solid. That leads us right into we can put $1 on that, dollar value on that. If you're making more money, that's pretty clearly a benefit to the individual and to the state. Yeah, so this is the Tennessee class size experiment. Those kids have been followed into adulthood. So it's large scale. It's not just something small like preschool. So I've already talked about these things, but these are not the only elements of rigorous policies, but you can think of this as a core.
And I saw some questions, which I'm sorry I missed, about curriculum. We do have a benchmark on curriculum, specifically what policies does the state have to support the selection and implementation of curriculum? It varies widely by each state. Some states have a required curricula list with maybe 1 to 4. Some have many curricula on the list. Some states require the curriculum to be aligned with the state's early learning standards. Some require the child assessments be aligned. So there are a lot of different elements to that, but we do collect that information also. And Vermont does meet that benchmark. But I'll move on to the next slide. Sorry, and I'll try to keep an eye on all of the questions. Oh, thanks, Lori. Back to you, Steve.
Right, so here we get to how much money is being put behind these policies, right? So the beginning point is your standards. These are really your expectations for what children will learn and be able to do, and what teachers need to do to make that happen. You can have, practically every state has great standards, but you can see they differ tremendously, almost by an order of magnitude, in how much money they give people to do those. Sorry to my family lives in Florida. I'm sorry to say what Florida as a state provides is nowhere close to what it takes to meet their standards, right? So unless your community, Miami-Dade, for example, has taxes themselves as a county, and school district provides a tremendous amount of resources in order for Miami-Dade to come close to meeting their standards. They're not doing it for the state's $3,100. I talked about our program in New Jersey. You can see it's funded at almost $16,000 per child. And I should say these are adjusted for state differences in cost of living. New Jersey actually spends more than that in actual dollars. It looks lower because we've essentially reduced it for a national comparison based on the high cost of living in New Jersey. District of Columbia, which is the system that in many ways is most comparable to Vermont in terms of being a universal program, beginning at age 3 with high standards for the goals of the program. You can see that's funded at close to $21,000 per child. And Vermont's down more in the middle of the pack, not that different from the national average in terms of spending. Of course, when we at NEAR look at how does state spending compare to what we estimate it would take to meet the requirements of their own standards, and to implement the 10 benchmarks that we think are the minimums that you need for an effective program, the vast majority of these state spending falls short, sometimes very, very short of what it would take to fund those programs. So getting your funding level right? Essentially the way to do this is to say, what is it that we want for our children and families? What do we have to do to make that happen? And then what does that cost? And unfortunately, most states don't do that. They start with, well, how much do we want to spend? And how many kids do we want to serve? And you divide the number of kids into how much we want to spend, and you come up with a number per child that more often than not is completely inconsistent with the stated goals for what you want to be able to do to serve those children. And it's really only a small number of states on the left-hand side of this that meet those requirements. Places like New Jersey and DC. They are not all wealthy states. You can see Arkansas is one of those, Nebraska, Kentucky, Oklahoma. They're not all states that are big spenders in general, or that have big budgets to spend. But they've worked this problem from the other side by saying, what is it that we need to spend to get the results that we want? To put Vermont in context, this is your spending per child with state contributions, federal contributions, local, compared to what Head Start spends in Vermont to provide programs for 3- and 4-year-olds. Head Start comes close to meeting all of the 10 benchmarks, that may give you a better idea of what it would really cost. Having said that, Head Start is a federal program with a set of requirements. I used to say the size of the Manhattan phone book. That in our world today is not something people are familiar with. Let's just say it's hundreds and hundreds of pages of requirements. A state program can be much more nimble, and therefore I think much more economically efficient than a federal program. But the gap between 9 and 21 should tell you something, as the gap between 9 and the almost $28,000 per pupil spent on K-12. Now, the K-12 spending number includes special education costs, and the pre-K number does not. The per pupil number comes from a variety of sources. So the per pupil K-12 number typically is based on state data that comes from state government. But these numbers are also provided by the teachers' unions, who keep very close accounting of what each state is spending on their K-12 programs. So there are 3 key decisions about financing your state preschool program. Once you've made the decision to say, well, how much money do we need based on what it is we want to do, then you have to ask, where are we going to get that from? In most states, they use multiple state revenue sources. They use local revenue. They use federal funds. I already mentioned local revenue, so that could be local government. It's easier to spread it around than it is to get it from one source. Having said that, if you're using a pre-K funding formula, like your school funding formula, to distribute the money, that can also be tied to ways of raising the money. And then states typically raise the money for preschool if it's included in the school funding formula, just as they raise the money for everything else in K-12. And so that depends on what your school funding system revenue sources are. And those vary tremendously by state. Some states, more than half of the funds are local, and other states, the vast majority are from state revenue. And some have these complicated systems where the state and local revenues are shifted around and in order to produce both the total revenue needed and to allocate it differently across districts based on local capacity and need. And that's one of the advantages of school funding formulas. States that don't use those typically simply give a flat amount. This turns out to be that, so that wherever you are in the state, whatever the needs of your local community are, you get the same amount as everybody else. That creates serious inequities and make it difficult sometimes for some local communities to even offer the programs. And so you have states like North Carolina, where some communities serve 85% of the eligible population, and some serve 15% of the eligible population, because the communities with the 15% have low local funding capacity and high local need, and they can't make the state funding work for them. So it's a key advantage to having a formula system, whether it's the school funding formula or something parallel, is that it increases equity, both in terms of who gets served, and how well they get served. So the key determinants of pre-K cost, I started with that as the beginning. Of course, the number of children that you're going to serve, but the goals and features of the program. That is what is it that we want to do for kids? And what do we need to provide? What does a program need to look like to make that happen? If we look at the states who use the school funding formula, 13 states plus DC include pre-K in their K-12 funding model. This includes Vermont. Pre-K students are included in the average daily membership counts for school districts. As I've already said, it provides more equitable basis for funding, but it's also more sustainable. What do I mean by that? If we look at what happened in the Great Recession, for example, the cuts were much larger to pre-K programs in terms of per pupil funding during the Great Reset, as in the aftermath of the Great Recession, in states that did not have their pre-K funding in the school funding formula. So it offers a kind of protection from economic downturns that other systems don't. It interests some states. We've got a question about, how does being rural factor in? Some states explicitly take, have in their formula criteria for adjusting funding based on how rural a program is, right? So rural programs have multiple challenges, transportation among them, that increase their costs, and that can be built into the funding formula. So that's certainly one of the things that can be taken into account. Now, having said that 13 states use the fund formula, only 7 states use it fully. Oklahoma and DC are 2 examples. They use it exactly the same way they do in K-12. Some states use it to set a foundation level, but they don't make other adjustments. So for example, we talked about making an adjustment for how rural a district is or community. Colorado and Texas don't do that. Categorical adjustments are things like adjusting for the percentage of students with special needs. If you're building that into your formula and addressing special education needs and general education needs together and not keeping them separate, then some states include that in their formula. Other states have taken that out for preschool. On average, the school funding formula states don't just provide more sustainable funding, they provide funding at per pupil levels that are closer to K-12 spending levels than other states. So it seems to increase adequacy. All right, and with that, we can transition to Lori.
Oh, hi, everybody. Thanks so much. I'm going to tag team with my colleagues and talk more about what's needed at the state level from state agencies to provide a strong infrastructure, guidance, policy to kind of meet these goals that were laid out by Gigi and Steve and to address some of the challenges and needs. So I know you had a governance study. And so what I'm going to talk about today is a study that we conducted a few years ago around effective state offices of early learning. So our view based on the research is that there is no research that indicates one governance structure is more effective in delivering a high quality pre-K program than another, but what the state office folks do and how it's structured and the functions is what is actually the drivers of the quality improvement and supports that are needed to meet the goals that Gigi and Steve outlined. We have the reference to this study, so I'm not going to talk a lot about it, except for the fact that we studied 4 states based on that they had data to support that they had a high quality pre-K program. These were Alabama, Michigan, New Jersey, and West Virginia. They each had, different governance structures. Actually, Alabama is a separate state office. New Jersey is within the Department of Education. West Virginia has a very interesting kind of governance structure that sets it up for shared responsibility across multiple agencies. Michigan at the time was in the Department of Education, but just recently moved. So why I wanted to spend a little bit of time is focusing on the functions that we believe are critical to think about as you all consider the shared governance that you have with the Department of Health and Human Services and the Agency of Education. And we wanted to kind of, end with this. So as you're thinking about the recommendations, you're also thinking about what is the role of the state staff, regardless of what agency they're in, and how they work together. All of the states in the study, and as we've discussed, the primary focus is on promoting program quality. So policies around what is required of the program, including the, meeting the near benchmarks, but other elements, including things like in Alabama, a specific requirements around, what the preschool classroom looks like and what kinds of materials are there in order to really focus on, as we, talked about a lot earlier, play-based, developmentally appropriate, the unconstrained skills and language and math and social emotional. For young children, you need resources. So really thinking through what is the state's role in promoting program quality, how they define, policy guidance, put resources out to programs to help them understand, what resources are needed to implement an effective preschool classroom. Guiding instructional quality. So earlier, someone asked the question about curriculum. Gigi will know the exact number, I don't, but there's only a handful of states that actually approve a research-based curriculum and require certain curricula for their programs. Michigan is the one that comes to mind immediately, but really thinking about the fact that, especially with the new National Academy study and other work, we know that a strong standards, curriculum, and assessment system undergirded by professional learning is what helps teachers improve, individualize, and really support children's learning every day, every year. And when a state agency has a responsibility and functions with staff and thinking could be cross-agency around what is needed to guide instructional quality, and that might include even the assignment of specific coaches around math or science or literacy in some states who have done that, is really, really critical. There also was a question, and we do know that we stand on the research that shows that highly trained teachers, but also highly trained assistant teachers are really important. And Gigi did a really important paper on this, is really critical. It's kind of the linchpin to having effective teacher-child interactions, effective teacher-parent interactions, and supports for young children's development. And as Steve said, we know we have a workforce crisis. However, the state plays a very strong role in developing alternative pathways. I've provided the Pre-K Implementation Committee with a memo that outlines a number of different ways that other states and communities are developing both alternative pathways to bring a diverse workforce into the system and allow them with opportunities to increase their competence, as well as ongoing supports. I'll put in the chat when I get a minute a recent study from Learning Policy Institute on effective models of coaching, which is, we know from the research, is the most effective way to support teachers. Alabama was featured there. Their coaching model is highly rigorous and developed, and really one of their cornerstones of their ability to kind of improve their quality and see some outcomes persisting into third grade. A state role has a really strong kind of responsibility for collecting and using research. We saw in some states, Michigan, for example, there's a line item around conducting research, both formative and summative research on the program. You have Dora here really and Building Bright Futures really focusing on data. Really important. It's data-driven, decision making is how you kind of monitor the GPS. And if anybody uses Waze, they know that they make mid-course corrections based on what they're seeing out there in terms of traffic and other issues. So there's a real role and need for state agencies and those overseeing these pre-K programs to really have a robust research and data function that is pushing that data out, both for the state at an aggregate level and disaggregated at the local level. We're talking about pre-K, but we also know, and we're talking about 2 years of pre-K, we also know that the transition to kindergarten and the early grades of elementary school are critical for maintaining the gains and for continuing to support children's early school success. And having an explicit function on how the pre-K administrator and the pre-K staff intentionally align with folks in whatever agency that have some responsibility for K3 is really critical, because the K3 system is fundamentally structured differently. However, really being intentional about ways that we're linking with the curriculum in kindergarten, curriculum and assessment in K3, the professional development and learning in K3 is really, really critical. And that really, again, supports this kind of sustainable, systemic focus on the effectiveness of a high quality pre-K. And then, of course, you have a really, big role around managing public resources. There are some states like New Jersey, actually, that monitor the pre-K budget and really spend quite a bit of staff time looking at that budget and making sure that local grantees or districts in New Jersey's case or others are allocating dollars effectively and managing public resources. So we'd like to end with that. I think we're open for questions. I think do you want me to go ahead and say this, Steve, or you want to set this one out?
I think we've really already covered it.
We have, but I think it's good for folks to just take a look at this. I believe it actually gives you a kind of a step-by-step way to approach it. There was a question that we got earlier about what are the lessons learned in expansion, and I think we've touched on those across the whole presentation. I think this sums it up in a really kind of succinct ways and helps you think about, this is what we've learned, right? This is what we've learned from those folks that have been, I think, successful at expanding and supported by the functions of those in the state and at other levels, administrators at local levels, in ensuring that this can actually happen.
And understanding it's a integrated, coherent system, right? That begins with your standards. That's the development and learning goals, right? And then curriculum and pedagogy follow from that. And there's some point about implementing with fidelity. Yes, your curriculum has to be, kids will only learn what you offer them the opportunity to learn. And if you're not offering them the opportunity to learn and develop skills that you want them to acquire, it won't happen. But you have to implement any curriculum, any pedagogical approach with fidelity. And so, for example, when we survey teachers about what they do and whether they use a curriculum, it's apparent that many of them who are not well prepared don't even really understand the question. They do not fully understand what a curriculum is. They might, there are systems where there is state mandated, state approved curricula, and the teachers will tell you they don't have one. which is a pretty clear indication they're not implementing it with fidelity. And so, having, this is where back to what Lori said about the supports the state has to ensure not only that you're adopting a good curriculum, but that you have the capacity to implement it well. And then using ongoing child assessment system that's aligned with the curriculum, not as a, high stakes assessment for kids, but to provide teachers with information about how well each child is doing, right? So that they know what's the next step on this child's path to learning how to make friends, for example, if they're having difficulty with that, right? This isn't testing them on, how fast can they recite the alphabet kind of a thing. And then these supports of, if you're really thinking about using data to continuously improve, then you have to develop the collective capacity at a program level, at the teacher level. The teachers have to have colleagues and leaders they're working with on how to improve, and each level up from that, whether it's the city or district or county, all the way up to the state level, and that each of these levels is providing some validation and improvement, right? That one of the values of the coach is, if as a teacher I'm not doing what I want to do correctly, it's probably because I don't know that I'm not doing it correctly. And if someone isn't giving me feedback, how am I going to learn that? Well, you can provide tools to help them do that, but even with tools, checklists or rubrics for evaluating my own practice, I need somebody, Novak Djokovic needs a coach. If he needs a coach, I'm pretty sure the rest of us will benefit from coaching. And the same thing, if you think about the state's role, which Lori has been talking about, the state needs to have the capacity to provide feedback to local programs to help them in their own continuous improvement process. So they have some, essentially the state's coaching. Not mandating and setting down, it's not a compliance system, it's a continuous improvement system.
Sorry, I don't know what happened, but we have the resources, some of the resources also it's listed. So we will share these we'll put them actually in the in here. And oh, sorry, I'm going to stop sharing. And I see a question. You know what? I can't actually see it now. Steve, are you able to?
There was a role
Steve
of
or Lori, could you?
that one. Which one?
It just disappeared.
What is the role of school districts? And that depends on how you design your system, right? In New Jersey, for example, the system is designed so that school districts are the hubs. They contract with private providers, right? So any for-profit, nonprofit, faith-based, who can meet the state standards can participate as a provider in New Jersey's program. This is done not by contracting directly with the state. Some states do that, and in New Jersey, they contract through the local school district. And local school districts then have one curriculum, for example, that everybody uses, whether they're a private provider or in a public school building. But the district as the hub is then responsible for providing all of the coaching if it doesn't matter if I'm in KinderCare or the Archdiocese of Newark program, if I have a child with special needs and we're having difficulty, the district is sending somebody to work with us to support that child and family. And so you have to think about how, that capacity doesn't have to be provided by a district. There are other ways of organizing a system, but somebody has to have the capacity. And in New Jersey, school districts and cities are largely the same thing, right? In New Jersey, almost every little place is its own municipality, and they almost all have their own school district. We have 600 and something school districts in New Jersey, and so it made sense to organize around them and have them be the hubs that provide this capacity to support local providers. Alabama does this very differently, right? But then they have an independent agency, has a much larger staff that provides these supports directly to providers that doesn't exist in New Jersey because school districts are doing that. So there's not one, as Lori said, there's not one right way to do that, but you have to design, however you design the system, you have to build in that capacity somewhere.
I think that if you looked at the report of the highly effective offices of early learning, you'll see different ways of contracting. They're all around a mixed delivery system. I think it is important to think about who has a shared responsibility for all sectors and all settings in order to support some of those functions around instructional quality and workforce capacity. And typically what we do find is where folks often underinvest is in that system to support effective programs and classrooms. And so as Steve said, in Alabama, there's a pretty robust regional network, and in Michigan, there is as well through Great Start Collaboratives. I do think that as we expand and as we are including mixed delivery, we really have to have some type of a local collaborative structure that has responsibility for kind of being close to the programs and providing this nimbleness in implementing policy that meets the needs of local programs, but is accountable to the standards that the state sets.
Yeah. And having said that, if you're in a state with lots of small school districts can be that local, close to the community organizer. And sometimes they may be the only places in rural communities that have that kind of capacity.
Thank you all. So as we transition into the discussion portion, I just want to invite folks who are able to turn your cameras on. You can continue using the chat bar for questions and comments for our panelists. You can also raise your hand and ask questions aloud. So just inviting you back into the space in a slightly different way. And as we're waiting for some of those questions, we do have a few more from our advanced questions. And for those of you who didn't have the ability to see some of the advanced questions that were sent near, I just wanted you to know we're very grateful to our three colleagues for bringing in the responses to those questions throughout the presentation and closely monitoring the chat. Some of those questions were around how Vermont should be thinking about the benchmarks within the near quality standards and how we should think about balancing the need to support the existing workforce and where they currently are, while also balancing the high standard for quality that we want to be working towards over the next 5 years and how other states have handled that tension. There were questions about, as we've seen pre-K models roll out in other states, what are the major lessons learned and what were the tensions and challenges that other states faced as they were implementing different program models. We also had questions about the delivery of pre-K compared to states across the country and what the top 3 things Vermont should prioritize as we consider expanding equitable access to pre-K and transitions in implementation. So as you all continue to think of questions, those are some of the things that partners had asked. One of the others that I'd love to have Lori, Steve, and Gigi start with is from our live session. And again, one of the questions that Lori started to respond to is, how do we balance the minimum education requirements for pre-K teachers as well as assistant teachers in the benchmarks with such a shortage of a qualified workforce? And are there states that are meeting all of those benchmarks, finding qualified teachers to fill those slots and meet the needs of all eligible children?
I'll say a couple of words, but I think, just to bring back what Steve said, no one is doing that like tomorrow. So there really has to be a strategic plan and thinking about. And there are, and there's multiple ways to do that. Certainly there are models where you're taking your current workforce who are not meeting that benchmark and potentially, putting them, identifying apprenticeship programs and others that put them on a pathway to meet the requirements over time. Most states, for example, even Michigan, in its new recommendations on the universal preschool for all, they are setting out a 6-year pathway. Because even though they had that mechanism in their current policy, it was a 3-year and then you could get a waiver for 3 years. In reality, it does take that much time.
And I think states have also, oh, sorry.
Oh, go ahead. No, please go ahead.
I was going to say other states have also done similar kind of pathways, but one of the other elements, just building upon what Lori just said, is pay parity. And parity not only just for salary, but also benefits. It's hard to compete when you can get a job at Starbucks or Target or Amazon or wherever else you get jobs that pay a lot more, have better benefits than a position that you need a degree as well as certification. So just building in that pay parity or a scale or some kind of way to get up to an equitable and fair wage is important.
Yeah, I think there's really two elements to this. And one is we've just talked about is compensation. And it's very clear that compensation is a strong motivator for the workforce. And if we have shortages, a key reason is not because our standards are too high, but because our pay is too low. I think the other thing to think about is the extent to which really allowing people to develop as professionals who are really, really good at what they do and successful in providing young children with what they need, how that also enriches and makes this a much more attractive job. The key is to create the on-ramps for the existing workforce and for folks who are not necessarily on that pathway to a 4-year degree and being a well-qualified early childhood teacher, to create the pathways and provide the supports that will allow them to succeed. If you're from a family that doesn't have experience with higher education, then navigating the system, even though everything may be in place for you to succeed, you don't know how to even access those resources or that they exist. And so, one of the things that has been very successful for states is essentially creating, putting resources into a system that helps people navigate and that prods higher education. I think I can fairly say this as a professor in a graduate school of education. We are not necessarily the most responsive or nimble to the needs of the state. Yeah, I mean, we're a state institution, we should be, but our governors focused our attention and basically said, we're going to provide money to higher education to prepare the workforce. This is what needs to happen in order for and so if you want it, you're going to have to do this, and you're going to have to do it on our 5-6 year time frame. It was amazing how fast higher education could move with those kinds of incentives. So and someone says giving a time frame is essential. That's exactly right. It matters less what the time frame is than that you set a date certain by which it has to happen. Now, that doesn't mean you don't have provisions, right? In New Jersey, we said 6 years. But if students had been making good progress and had, they were on their way, life happens. We didn't say, sorry, 6 years are up, tough luck. Now, if 6 years have come and gone and you didn't do anything, right, you're not really on a path. But so there are very practical ways of making this happen. But I will go back to the key is resources. You have to put that resources, and they're not large, into the higher education system to support students navigating this process successfully. You have to put the compensation where it needs to be to make it attractive. And in New Jersey, they doubled their pay and got benefits that they'd never, health and retirement, that they'd never been eligible. They hadn't had before at all, right? This is a dream come true for people, that they're willing to work really, really hard to get there. If you make this a rewarding job with rewarding compensation, that really does transform their lives. And so many of our teachers, they're one accident, health problem, car repair issue away from not being able to keep their jobs and support their families. To offer them the opportunity to be in a much more financially secure position and to be really good at what they do. There are relatively few people that say no to that opportunity.
Thank you, Steve. I'd love to have you all talk a little bit about inclusion in universal pre-K. I want to also bring in the voice of a mother who commented in our chat. And she said, as a mother of an autistic individual, we were pushed out of our childcare due to a lack of teacher education, training, and due to a class size of 22. They could not support our needs, and it has shown as an ongoing deficit for many parents in our community. So can you all talk about the importance of inclusion, what supports and resources we need to think about in terms of what needs to be in place to both support students in early childhood education settings, specifically for those with disabilities and special healthcare needs, and what does that mean for the workforce as well?
Well, first, she's exactly right, right? That is the situation in many places, far too many. And it intersects with all of these issues that we've talked about. As she points out, the teacher has to be prepared to have the knowledge and skills. The teacher needs to have supports to add to the knowledge and skills that the teacher brings into the classroom, because you can't know everything and do, right? It's collective capacity. You have to have a class size that permits you to give individual attention to children. 22 isn't that. Then you have to have thought through this system. So in New Jersey, I will say this is not something that the state has been as good at as I would have liked to see in fulfilling their responsibility to support districts in accomplishing this goal, because there are districts that went to full inclusion. They just essentially disbanded their preschool special education, their self-contained classrooms, and said, we're not doing that. We have universal preschool. We don't need these separate classrooms. That doesn't mean there are not some children will need clinical placements. But they're relatively few. Most of their kids went into regular classrooms, and their teachers who had self-contained classrooms became itinerant support specialists who moved across the inclusion classrooms. So they shifted their role, and they served twice as many children with special needs after they went to Universal as they did before. And partly that's better identification, right? And partly that's they transition to a more efficient and effective way of serving kids. But that takes system-wide planning to make that happen. And too often, early childhood special education and the rest of the early childhood folks don't even talk to each other, much less plan together in an integrated way to serve children together. And so you know that's a responsibility that districts in the state have to take on together to make that happen, or it won't. It's not just going to happen because you're universal.
Yeah, I think that's a really good example of what I was trying to convey in the functions of a state agency or state infrastructure. These are the kinds of things that the state actually has to set some policy around and really possibly work through the challenges of the way the IDEA funding flows. And again, then provide resources, supports to both districts and community-based programs. But I see I think in the ideal world, you would have a state agency and or infrastructure, perhaps, in partnership with Building Bright Futures as the Early Learning Advisory Council, identifying these areas, being on the lookout for ways that you need to continually be improving your program, and identifying those children that you want to have access that are not having access to the appropriate education. And there's tons of supports out there. There are some states that do a better job than others. I think Illinois is one of them. Illinois is also one of them that does a better job with dual language learners, requiring bilingual certification. So I think this is why you need a strong, functioning governance structure that really is thinking about these areas and these issues and developing policy that can address it over time.
Gigi, anything you would add?
No, but I was just going to put in the chat, just to add to it, we have done, similar to our yearbook, we have done a report that came out on the state of early intervention and early childhood special education and a look at equity. And in the report, and I'm going to put the link in here, there is state-by-state profiles similar to the yearbook. And it's a really helpful place. And I was just glancing at Vermont's profile to see how Vermont does compared to other to nationally, as well as you can look and compare states in terms of like preschool expulsion, kind of who has access, who has IEPs, and kind of look at that information. But that's another really good place, is to look at the data to see what policies, what things need to be addressed to help address some of these inequities that are occurring.
I will add that Gigi and I are in the final stages of writing a brief on this, a guide to increasing inclusion opportunities for preschool children for the, funded by the Alliance for Early Success. So we can send that out to you in draft and you can take a look at it, but we will have, it's basically the guide is kind of an approach to how you address this, how you develop a plan to ensure that you're increasing opportunities for inclusion, which are really critical. And I really feel for the mom who put in there about her child's experience. I mean, that gets at some of the other challenges that we have around inordinate, rates of suspension and expulsion in preschool, which is, again, another role for a highly functioning and effective state offices of early learning.
Thank you all. I think we have time for probably 2 more questions, and I promise I will give all of the questions we've captured to our panelists. But one of the more recent questions that came through the chat is, as you think about the way Act 76 is likely to appropriately ramp up all of the professionalism and related compensation factors in Vermont to the levels that you're suggesting that are truly essential, is that going to get us where we need to be? How do we think about transitioning the workforce and making sure that we have the right the right pathways, recognizing that we have incredible partners in the state of Vermont, like Vermont UAC and others who are really leading the charge alongside the national partners.
Now that's where your continuous improvement system is key, right? So these things are resources to succeed. They don't guarantee success. Right? So you have to, you have a plan, right? So in New Jersey, for example, we developed a tool called self-assessment validation system, right? So that plan, do, review, right? That's your continuous improvement system, whether you're a 4-year-old in the classroom or a state leader. And so at every level in the system, right? So you have this at the self-assessment validation system was at the district or community level. And it's essentially a tool and a rubric for how do we evaluate our progress in terms of where we're supposed to be in terms of developing the workforce, the quality of our classrooms, right? So was a coalition of higher education that's collecting data, right? The coaches and the districts are collecting data on classroom quality, but there's also an external validation of that by higher education, looking at the quality through observation. And there's a variety of brand new tools that hardly anybody in the US uses that are really good for doing this, by the way. And so, is our quality moving? Assessing samples of kids, not testing all your kids, to see are the kids developing in these deep domains the way we want them to, and then here's our plan at the district or community level, and the state's engaged with looking at that and saying, well, great, here are some suggestions, or that's not going to get you where you need to be. That's just wishful thinking or hand waving. You need to do X, Y, and Z, and getting that kind of feedback into the system is what's really going to guarantee that you're not just spending money, but you're actually getting the payoff from what you're putting into the system, right? So, I don't know how many of you are familiar with the Early Childhood Environment Rating Scale. That's what we used 20 years ago. If you're below a 3, the question is not whether you're helping kids. The question is how much you might be hurting kids. We had a substantial percentage of our programs below a 3. Within 5 years, that didn't exist. There were none. Right? Nobody was operating that poorly. That's the kind of indicator that you got in place that ensures that your system really is moving and doing what it's supposed to do.
Steve, I really appreciate the focus on continuous quality improvement and thinking about what the most appropriate benchmarks are, how we think about that monitoring. In the last 3 minutes for the 3 of you, I'm going to ask one more question that I feel like is really important as we think about the next legislative session in the state of Vermont. But what's the top priority, the top 1 to 3 things that you think we should prioritize as we consider transforming, expanding equitable access to pre-kindergarten education over the next 3 to 5 years in the state of Vermont? And I think that you've heard a lot of the discussion through the legislative session, and you all have brought so much expertise. Are there things that you would say, Vermont, you need to keep these pieces because they are core and instrumental and valuable? Here are the things to prioritize. So if each of you want to give me 1 or 2.
Keep 3-year-olds. Don't cut back on those, because having 2 years is better than 1. And keep mixed delivery. I think that's and that just go to coaching again. Coaching is not only required for public school teachers, but not non-public school teachers. So thinking about having equitable quality for both settings. I'll pass it to you, Lori.
I think I would just, reiterate what I said before. I think you have to get serious about the governance structure and the functions and roles that each are going to play, and really put some, intentionality around that, about what the role is of the state and the functions that they can have authority over, and how they work effectively with local folks.
All right. So I'll back clean up here. Vermont has a great foundation, right? I think there's so much public will, such a good foundation in terms of the desire to have a universal high quality system in Vermont, that you just, step number one from where you are is to say, okay, what is it that we want to have for our kids? What do we want to be able to do, and what do we have to do? What does our class size have to be? What do our teachers need to be? What kind of supports do we need to provide for continuous improvement in that system? And then cost that out. What is it really going to take? We're not going to engage in wishful thinking about, we can wave a magic wand and make this happen. What's our timeline? And what's a plan to do that? And then having set that out, execute. That's but if you don't have that set out, that is never going to happen. And what's the funding strategy to make that happen? And some timeline, it doesn't matter, 6 years, 10 years, but that the can doesn't keep getting kicked down the road. And a way of building consensus around that, so that, when we embarked in this in New Jersey, we had essentially 85% public approval. And when we started, it wasn't universal for the state. It was universal in 31 cities with high concentrations of poverty. So it was mostly people having high levels of approval of doing this for other people's kids. This is possible, right? You have to, but so there's a strong public will building part of this. And I think that, you're in a great place because of the resources you have to generate the data and get that out into the public in a way that builds support. And nothing builds support like success itself. Just give you one example of that. Alabama was like so many states with, it's the Alabama Voluntary Pre-K program. And it's not very exciting. They did such a good job of designing, funding, and getting this program up going. They changed the name to First Class. Right? Play on words. Think about Alabama, probably the poorest state in the country outside of Mississippi and New Mexico, saying we're going to give a first-class preschool education. We're going to fund this at a level that's unheard of for a state with our kind of financial capacity. And we're going to be proud of that, because, other than football, it's probably the only thing that we're number one for. And we're going to celebrate that and reinforce it. And there's no going backwards. They are not going to undermine quality in preschool in Alabama any more than they are going to undermine quality in football.
Thank you so much for that example, Steve. And thank you, Gigi, Lori, and Steve, for the incredible presentation. Such a wealth of expertise and recommendations and things for us to consider as we are making changes in our system in the coming years. So thank you so much for being with us today. I want to thank the over 70 participants for being in the virtual room with us today. And A couple of updates and things to be thinking about. We are having our next Early Childhood Grand Rounds seminar panel a month from today, July 18th at 10 a.m. And this panel is on family voice and leadership. And so Dora's going to paste in the chat the Zoom link and the registration for that. We also have our upcoming data and evaluation meeting, which again is open to the public on September 21st from 1 to 2:30. If you are not yet a part of that team and want to be in that space, you can email data@buildingbrightfutures.org for more information. And our last reminder is to please check out our new early childhood data portal, where we've centralized over 100 indicators on the current status, well-being, and the system of Vermont's early childhood system. So thank you so much for being with us today. That concludes Early Childhood Grand Rounds for June.